Good evening. I am Dr. Jeffrey Sterling, Surgeon General for Alpha Phi Alpha Fraternity, and I welcome you to tonight's event in the Alpha Phi Alpha Surgeon General Initiative Health Webinar Series. On behalf of our General President, Brother Drs. Willis Lonzer III, I trust that you will find tonight's update on COVID-19 informative. Now, I must say that even as COVID seems to assume a lesser priority among the nation, over 1,000 lives are still being lost per day in the United States. I hope you will stay informed and protected. We welcome back tonight as our moderator, Alpha Phi Alpha's Deputy Surgeon General for Public Health, Dr. Torrance Brown. Currently, he serves as the Division Director for State Programs with the U.S. Department of Health and Human Services Center for Substance Abuse Prevention. Most recently, he has also served as Branch Chief for the Evaluation Branch in the Policy Division of the Strategy, Planning, Policy, and Requirements Office within Health and Human Services Office of the Assistant Secretary for Preparedness and Response. In these two roles, his responsibility has included oversight of cooperative agreements, grants, and programmatic outcomes in support of multi-million-dollar federal programs to support communities, hundreds of healthcare coalitions, all 50 United States, territories, and freely associated states. Brother Dr. Brown is a member of the Pi Epsilon Lambda chapter of Alpha Phi Alpha Fraternity and is currently active in Alpha Eta Lambda chapter. Welcome, good evening, have a great show.
Hey, good evening. I'm Brother Torrance Brown, and I bring you greetings from the Pi Epsilon Lambda chapter here in Prince George's County, Maryland, just outside of Washington, D.C. Before we begin, please join me in a moment of silent reflection for the brothers that we have lost to this pandemic and their impacted families, friends, and social networks. Thank you. According to the CDC, to date, there have been a total of 45 million plus cases of COVID-19 in the United States. To date, there have been an approximate of 730,000 deaths related to COVID-19. There have been approximately 77% plus of the total population 12 and older who have received at least one COVID vaccine. At this point in the pandemic, we are aware that persistent health disparities combined with historic housing patterns, working circumstances, and other factors have put members of some racial and ethnic minority populations at higher risk for COVID-19 infection, severe illness, and death. Brothers, it is imperative that we are informed and help to inform other brothers. In a recent report released by the Brookings Institute on October 19th, they report that men are much more likely to die from COVID-19 than women. The pandemic has cut the life expectancy of American men by more than 2 years. The report cites that the overall death rate for men is 1.6 times higher than the death rate for women. The numbers are more striking in the Black community. The report recommends improving access to care and addressing vaccine hesitancy, especially for Black men, should be high priority. In our last conversation on August 19th, we discussed vaccines and the importance of accessing the right information from reputable sources, including the Department of Health and Human Services agencies, to include the U.S. Centers for Disease Control and Prevention, the U.S. Food and Drug Administration, and the National Institutes of Health. We also talked in detail about the importance of establishing a relationship with the healthcare provider to partner in our care and for navigating COVID-19. Today, we continue these conversations by highlighting vaccine facts, vaccine implications for youth, boosters, and the flu, navigating travel, and how best to continue to protect ourselves and our families during COVID. This evening, I'm joined by two esteemed brothers of Alpha Phi Alpha Fraternity Incorporated, Brother Michael A. Dawson. Brother Dawson is a native of Augusta, Georgia, a two-time graduate of Howard University. Brother Dawson earned his undergraduate in medical training from Howard University College of Medicine. Brother Dawson completed his residency in family practice at Howard University Hospital. Brother Dawson has extensive experience as a practicing family physician in providing care in outpatient, nursing home, and hospital settings. He is board certified in family medicine. Brother Dawson is currently employed by the Defense Health Agency at Fort Lee, Virginia, where he provides health care to military family members and retirees. Our next panelist for this evening is Brother Getson Hall. Brother Hall, MD, PhD, is an assistant professor of medicine and nephrology at Duke University School of Medicine. He received his MD and PhD degrees at the University of Maryland, at Baltimore School of Medicine, and completed his internal medicine residency and nephrology fellowship training at Duke University. He is faculty at the Duke Molecular Physiology Institute, where his laboratory focuses on genetics of inherited kidney diseases with a special focus on protein wasting kidney diseases that disproportionately impact African Americans. Brother Hall is a member of the Beta Theta Lambda chapter. Brothers, welcome.
Thank you.
We'll jump right in. Before we jump right in, actually, we'll talk about a few key things that we want brothers to walk away with. COVID-19, to sort of level set the conversation, it's important to highlight several key things to know about COVID-19 and the COVID-19 vaccine. COVID-19 vaccines are effective at helping protect against severe disease and death, including the variants. Vaccines are now being approved for children 5 to 11 years old against COVID-19 with the Pfizer-BioNTech pediatric vaccine. If you're fully vaccinated, you should wear a mask indoors in public. If you're in areas of substantial or high transmission, being fully vaccinated and wearing a mask maximizes protection. Stay 6 feet apart from others who don't live with you. Avoid crowds in poorly ventilated indoor spaces. Wash your hands often with soap and water. Use hand sanitizer if soap and water aren't available. People can sometimes get COVID-19 after being fully vaccinated. However, barring no other health conditions that threaten or weaken the body's defense, symptoms tend to be mild. During the last session, there was a specific question related to nutritional supplements and COVID. According to NIH, currently data are insufficient to support recommendations for or against the use of any vitamins, minerals, herbs, or other botanical fatty acids or other dietary supplements, ingredients to prevent or treat COVID-19. And by law, dietary supplements are not allowed to be marketed as a treatment, prevention, or cure for any disease. Brothers, let's dive right into the conversation. The first topic for discussion this evening is long COVID and breakthrough cases. Although most people with COVID-19 get better within weeks of illness, some people experience post-COVID conditions. Post-COVID conditions are a wide range of new, returning, or ongoing health problems people can experience 4 or more weeks after being infected with the virus that causes COVID-19. A breakthrough infection is an infection with the virus, bacterium, or other germ after you have been vaccinated. This is an expected occurrence for a small percentage of those receiving any vaccine, since no vaccine for disease is 100% effective in preventing infection in every person who receives it. In recent weeks, we learned of General Colin Powell's death that was attributed to a breakthrough case. Hopefully we can talk more about the circumstances around this particular breakthrough case during this segment, but we'll kick it off with Brother Dawson. If you could start us with what are the facts that we should know about long COVID syndrome? You're on mute, Brother Dawson.
Thank you. Apologize. Thank you, Brother Brown, and good evening. I guess the key point to take home here in terms of long COVID syndrome is most people who are infected with the COVID-19 virus recover within 2 to 4 weeks. That means that majority of their symptoms have completely resolved. Some people may have a slight residual cough at that point, but typically at the end of 4 weeks, it's resolved. There are those, however, that have long COVID syndrome. And what that means is that they continue to have symptoms beyond that typical 4-week period. And these symptoms can include a wide and varied constellation of symptoms. They can be everything from fatigue, upper respiratory symptoms, loss of taste or smell, diarrhea, headaches, practically any of the symptoms that people experience actually during the acute infection can be present in the long COVID syndrome. Some of them will resolve, and some of the symptoms that are typically present may resolve. However, some may persist for sometimes weeks, and in some instances, unfortunately, for months.
Thanks, Brother Dawson. Brother Hall, how common are breakthrough cases of COVID? Can you speak a little bit to that?
Sure. Thank you, Brother Brown and Brother Surgeon General for assembling this event. So again, the vaccines are intended to prevent the most severe outcomes of SARS-CoV-2 infection or COVID-19 disease. And when you encounter the virus, it still has all of its own capabilities to enter your body. In the case of a vaccinated individual, Your body has pre-prepared, in a sense, to defend against infection. So the likelihood of you developing an infection is low. It is in people who have been vaccinated but who have impaired immune systems, like Colin Powell. You can still have, because of a defective or insufficient immune response, you can still have full-blown impact of COVID-19 once you are infected in that scenario. But for those of us whose immune systems are competent, who can respond to the vaccine and produce antibodies to defend us, the likelihood of a breakthrough infection is rare, even though, although we are seeing more of it, because the Delta variant seems to be capable of producing infections, despite the fact that the coverage of the immune system exists after vaccination. So rare, but still possible.
Good deal. Thank you, Brother Hall. And I guess in terms of the follow-on question to that, what is the risk of long COVID with the breakthrough coronavirus case? I know we talked a little bit about the long COVID, Brother Dawson, and the breakthrough case with Brother Hall. Brother Dawson, can you speak to the risk of developing long COVID with the breakthrough case? You're on mute, Brother Dawson.
We're still accumulating data on just what the risk for long COVID is, as well as breakthrough. I think this varies depending upon populations. Patients who have somewhat immunocompromised or are less likely to mount an adequate immune response to the vaccines are more prone to have breakthrough cases. And of course, anyone who has a breakthrough case is also going to be slightly more likely to develop long COVID symptoms. The long COVID symptoms, this is an ongoing evaluation, and as patients present with these symptoms and complaints, we are evaluating them and basically treating the symptoms and overriding residual medical problems going forward until they resolve or the patient is improving.
Thanks, Brother Dawson. Anything to add to that, Brother Hall?
I would just say generally that the vaccination seems to be, for those people who have been vaccinated, the likelihood of long COVID is reduced. As Brother Dawson mentioned, we're still accumulating data on the overall risk and what profiles the type of patient that is most susceptible to long COVID in that set of conditions. But nonetheless, the efficacy of the vaccines and their effectiveness at preventing infection or reducing the most severe outcomes of infection have borne out as well in terms of the incidence of long COVID. The early data would suggest.
Thanks, Brother Hall. So as a takeaway point for this segment, the takeaway points for this segment are still, they remain the same as they were during our last segment, is to make sure that you take precautions to protect yourself against contracting COVID-19. We know that vaccines are effective. The Pfizer vaccine is recommended for people ages 5 and up. Wear your mask indoors, stay 6 feet apart, avoid crowds and poorly ventilated indoor spaces, and wash your hands often. These are all key to making sure that we do not contract the COVID virus, and in the event that we do, to make sure that we don't contract the COVID virus and to prevent opportunities for breakthrough cases. In the next segment, we're going to talk about vaccine implications for children and youth. There are 72.8 million children under age 18 in the US, 22% of the population. Children under age 12 are not, they're not eligible for the COVID-19 vaccine, representing 14.5% of the US population. The CDC recommends that everyone 12 years and older should get a COVID-19 vaccination to help protect against COVID-19. Just recently, the U.S. Food and Drug Administration and the CDC also recommended children 5 to 11 can get the Pfizer COVID-19 vaccine. The first question for you, Brother Hall, is we covered in depth in the session in our last discussion, but it's worth repeating and revisiting. Where might parents and caregivers go to find the latest information specific to vaccinations for young children and youth?
Yeah, that's a great opportunity to talk about reliable sources of data. So the best place, or I'll tell you the places that I go. Every day I have a bulletin from the Johns Hopkins COVID disease tracker, which essentially publishes new information on a daily basis about the rates of COVID infection and death throughout the country. As of today's bulletin, we have passed the 750,000 dead mark, just a little over that as of today, according to Johns Hopkins University. You can sign up to have these pieces of information come to you. You can also refer to the COVID data tracking information maintained by the Centers for Disease Control, cdc.gov. COVID data tracker is where you can find that information. And essentially, it can provide you with county level data in your state, in your city, about rates of COVID, the number of people within a given area that have been vaccinated, percentage of vaccination within a population confined to a geographic area. So that type of information is really granular, and it's helpful to people and the healthcare providers that they speak with to discuss actual information that is tracked and maintained, curated in databases by reputable sources with resources to do that type of work. It is not you do not want to get your primary source of information from person-to-person conversation, from Facebook, from Instagram, or wherever, whatever other social media you might go for casual information. This particular type of health information should be, you should go to sources that that have expertise and curate this information on a regular basis.
Thank you, Brother Hall. Brother Dawson, what are some strategies that parents can employ to learn how best do we prepare young children and youth for the COVID-19 vaccine?
Well, as a family physician, this is kind of near and dear to me. And really, the key component that I see in terms of children being tolerant and able to receive vaccines is the parents. The parents' level of anxiety and comfort is transmitted to the children. The children sense that. So what is really key is that the parents understand exactly what the purpose of the vaccine, what the benefits of it are, and when they do that, and the fact that it's a low risk compared to the great benefit, when that information is transferred to the parent rather, the parent somehow just by modeling will relay that information to the child. The child is very sensitive to any anxiety or angst or nervousness that a parent has. So if you can make the parent more comfortable, that information will be relayed to the child, and the child will be much more able and comfortable with receiving the vaccine. It's important for the parent to talk to the child, and it's also important for the provider physician to talk to the child and explain what the process is and exactly what's going on. And again, if you treat them as young people and involve them in the process, they're much more comfortable when they feel like they have some control and power, even though obviously they don't.
Thank you, Brother Dawson. Brother Hall, children and youth are already required to take vaccines as they matriculate through school and at various ages. Are there any known negative or adverse interactions between the COVID-19 vaccine and other vaccines required by children and youth?
That's a great question. So for parents that are considering trying to make a decision about vaccinating their children, that's probably one of the things they want to know first. Is this going to interact with other vaccines, and what should the timing be? I think for your healthcare providers, they're going to be drawing on the data that was obtained from the study of the Pfizer vaccine in children. This began in June of this year and finished up, I guess, late September, early October. In terms of vaccination interactions, I have not encountered any data or information that would suggest that interactions between vaccines are a particular problem. The side effect profile in the study that was run over the past few months, or since the summer, on kids 5 to 11 years of age, is actually fairly similar to that observed in adults. It's a reduced dose of the medication, a third of the dose of what adults get. It is administered in 2 doses, 3 weeks apart. And of course, to develop full immunity on the back end, you're going to have to wait about 2 weeks beyond the last shot to believe that the child is fully protected. You will need to talk, and I would encourage you to talk to your provider about all the risks associated with getting the COVID-19 vaccine, along with or as a standalone vaccine for viral infection. Other vaccines, other illnesses actually should not be forgotten in this context. Flu vaccine this year for children is absolutely essential. And so parents and children should be getting that vaccine as well. In general, when you're considering whether or not to vaccinate your child for COVID-19, it needs to be thought of in not only for COVID, but the MMR vaccine, measles, mumps, and rubella, flu, and other potential pathogens that are required or vaccinate, for which vaccination is required, particularly for children entering the school setting. So those conversations early and in depth to the parent satisfaction should be prioritized.
Thanks, Brother Hall. So takeaway points for this segment: refer to reputable sources. Brother Hall gave us a list of sources. Johns Hopkins, CDC are good reputable sources that we should sort of stick with. And Brother Dawson told us that our kids pick up on our psychological and physical response. And so if we're calm and cool, calm, and collected, then our kids will be cool, calm, and collected. So that's something that we need to keep in mind. Also, we need to make sure that the providers are talking to the kids also to tell them what's going on, what's happening, to include them in the process. And then also to make sure that we talk to our providers about what's happening, what to expect, and how might we mitigate any risks associated with receiving the vaccine. Those are our takeaway points for that segment. We're going to move right now into talking about boosters. According to the CDC, 191 million plus people are fully vaccinated. 14 million plus have received the booster shot. Data from small clinical trials show that the Pfizer or Moderna booster shot increased the immune response in trial participants who finished their initial series 6 months earlier. A similar clinical trial showed that the Johnson & Johnson booster shot also increased the immune response in participants who completed their single-dose vaccine at least 2 months earlier. With an increased immune response, people should have improved protection against COVID-19, including the Delta variant. And Brother Hall, the first question goes to you. Are booster shots the same formulation as the current COVID-19 vaccines?
Yes. So adults who received the 2-shot regimen, either for Pfizer or Moderna, or the 1 shot for Johnson & Johnson, would receive just 1 dose of the same formulation for the booster.
Okay. Brother Dawson, could you speak to why do we need a booster shot?
Well, the research and studies have shown that the immunogenicity or protection against the infection tends to wane with time. And that's also evident with some other vaccines. And what we've realized is that after approximately 6 months after the Moderna or the Pfizer vaccine, we're beginning to wane enough that they think a booster is indicated. And with the J&J vaccine, we're talking approximately 2 months. Now, before I talk about, before I go further, I want to revisit. In terms of the primary series, the Moderna vaccine involves 2 shots, two injections 4 weeks apart. The Pfizer vaccine requires 2 injections 3 weeks apart. And after both of those injections, you are considered fully immunized. And the J&J vaccine is only 1 dose. And 2 weeks after that injection, you're considered completely vaccinated. However, because of the increased infectivity of the Delta virus, as well as the with time the decreased response to the immune system, the boosters have become necessary and are recommended in certain populations.
Thank you, Brother Dawson. I have one follow-on question. What is the risk associated with the booster?
The risk with the booster shots is very similar to the risk of the primary shots. In other words, the most common symptoms are going to be fever, some muscular discomfort at the injection site, some chills, and some fatigue briefly. And for the most part, the booster shots have the same side effect profile, and most patients have minimal adverse effect with the booster shots as well.
Okay, thank you. The next topical area deals with the flu. According to the CDC, flu activity was unusually low throughout the 2020-2021 flu season, both in the United States and globally, despite high levels of testing. During September 28, 2020 through May 22nd, 2021 in the United States, 1,675 of 818,939 respiratory specimens tested by the U.S. clinical laboratories were positive for an influenza virus, or this is 0.2%. This is just low. The low level of flu activity during this past season contributed to dramatically fewer flu illnesses, hospitalizations, and deaths compared with previous flu seasons. COVID-19 mitigation measures such as wearing face masks, staying home, hand washing, school closures, reduced travel, increased ventilation of indoor spaces, and physical distancing likely contribute to the decline in the 2020 to 2021 flu incidents, hospitalizations, and deaths. Influenza vaccinations may have also contributed to reduced flu illness during the 2020-2021 season. Brother Dawson, is it safe to get the COVID-19 and flu vaccine at the same time?
Yes, studies have shown that it is quite safe that the COVID-19 vaccine and the influenza vaccine can be given at the same time at the same office visit, okay, with no increased side effect profile or adverse effects.
Okay. And Brother Hall, what is the best time of year to get the flu vaccine?
Yeah. So generally speaking, I think of it as a holiday vaccine in the sense that around the time we begin our annual fall celebrations, October being the first with Halloween, to get your vaccine in the month of September, October, around that time is typically what I would recommend. And then for COVID-19, a booster dosing when it's made available to you. If, like Brother Dawson said, if you do choose to get them both in the same day, the side effect profile is the same. I chose that option. What I experienced was a day of fatigue, actually some of the best sleep I got in that month. And the next day I felt great. So there's not an increased risk of side effects. But around that timing, September, October, I think would be the best for flu on an annual basis.
Thanks, Brother Hall. So the takeaway points for this segment is that it's safe to get the flu and COVID-19 vaccine, and also that the fall is generally a good time to get the flu vaccines, the September, October timeframe. So moving to the next segment.
Brown,
yes.
I did want to make a brief comment, a follow-up comment, basically. It's important to get both the influenza and COVID-19 vaccine at this time of the year if you have not done so, because as the temperature drops and it gets colder, the incidence and transmissibility of both of these infections will go up. So it's very important to be protected before we reach the high point of the season. So if you have not done so, you and your loved ones should get vaccinated against COVID-19 and influenza.
Thank you, Brother Dawson. In this next segment, we'll talk a little bit about travel. According to the CDC, people who are fully vaccinated with an FDA-authorized vaccine or a vaccine authorized for emergency use by the World Health Organization can travel safely within the United States. Brother Dawson, this question goes out to you first. What are the travel recommendations for folks that are fully vaccinated?
Well, for people that are fully vaccinated, I'm going to contrast this with folks who are not vaccinated. For people that are not vaccinated, you should get tested 1 to 3 days before travel, and you should also get tested 3 to 5 days after travel, and you should self-quarantine after returning from your trip. And if you have symptoms, then you have to get tested and also make sure that your family members also get tested if you've been exposed to anyone. For those who are fully vaccinated, you don't have to go through either the testing beforehand or afterwards. Now, this is for domestic travel. Now, if you have symptoms, of course, after returning from a trip, then of course you have to self-isolate and it's appropriate to get tested. For international travel, you have to, I would use the reference of the CDC because depending upon where you're traveling to, each municipality will have regulations and guidelines that you must follow to travel to that location.
Thank you, Brother Dawson. Brother Hall, do you have anything to add to that related to travel? I know he talked a little bit about both vaccinated and unvaccinated. So do you have anything to add to that?
No, I agree with everything Dr. Dawson said. I would just say that the CDC COVID data tracker is not just for tracking COVID-related statistics. It also provides information on travel places you can go, the restrictions in those areas as well. I would say that for people who are traveling, especially to see family this season, make sure that you have, particularly if you have vulnerable family members who have had, for instance, a solid organ transplant and they're taking immunosuppressive drugs, for instance, that you are following measures to protect them. This is sort of the moral imperative around getting vaccinated. The idea that even among the vaccinated, there is a potential for breakthrough infections, as we discussed earlier, and you would hate to transmit a breakthrough infection that you barely experience as a vaccinated and protected person to a person in your family who's vulnerable. So just be careful, mask wearing, hand washing, all of the measures that were stated before, and understand what situations you're going to be traveling into and what risk you might pose to vulnerable people.
Thank you, Brother Hall. I'll recap the takeaway points for travel. For vaccinated travelers, wearing a mask, avoid crowds and stay at least 6 feet apart. Wash your hands, self-monitor for COVID-19 symptoms, and follow all state and local recommendations or requirements. For unvaccinated travelers, get tested 1 to 3 days before your trip. Wear your mask, avoid crowds, get tested 3 to 5 days after travel, and stay home and self-quarantine for a full 7 days after travel. Those are our takeaway points for travel. Next, we're going to talk about treatments for COVID-19. In May 2020, the U.S. Food and Drug Administration granted an emergency use authorization for clinicians to use the drug called remdesivir, which is administered intravenously in hospitals for people with severe COVID-19. In November of 2020, monoclonal antibodies, which are laboratory-made proteins that mimic the immune system's ability to fight off harmful pathogens such as viruses that are specifically directed against the spike protein of the SARS-CoV, designed to block the virus attachment and entry into the human cells. In October 2021, Merck reported on a promising new drug treatment that could be given as a pill in the days after COVID-19 symptoms arise to prevent severe disease. Brother Hall, I'll start with you. How is the COVID-19 pill intended to work?
Right. So this is actually a therapy recently released by Merck Pharmaceuticals. I have no relationship with them, by the way. I'm just reporting information. And they are generously authorizing the release of their formulation to countries all across the globe so that they can begin to use this as another tool to suppress circulating SARS-CoV-2 in the local environment. It's a measure of protection for us all, the more people who are defended in one way or the other. The mechanism of action is not, I think, open for public discussion at this point. I have not been actually able to find anything describing the way the pill works other than that it's an antiviral. So it's likely something that targets the replication phase and prevents the virus from replicating. If you've had flu and you've gone to the emergency department and they've given you or to your primary care doctor and they've given you a pill, oseltamivir, it's the type of medication that prevents replication of the flu. And so it's intended for people who have mild to moderate disease. It will cut the infection off at the earliest stage and allow you kind of get back to life. Give your immune system an opportunity to overcome and clean up what virus has actually made it into your body without allowing the virus to amplify out of control and produce infection. What I will say is this, though, the virus has the ability to mutate like other viruses do. It mutates in the replication phase. The more time that the virus is allowed to circulate in the population, the more of a problem this is, because you're giving the virus more opportunity to figure out the way the immune system works and to shuffle its genetic code to come up with ways to defend against those protections. So this is a great strategy for dealing with short-term infection. It does not replace the need for getting a vaccine. So when this is released, if it is approved, please make sure that you still make the decision before you take a pill that was developed quickly into your body. Take the vaccine. We have now had, over the past year and 18 or a year and a half, we have had the largest essentially clinical trial of the vaccine, 3 vaccines in history. So this is abundant evidence that the vaccines are safe. That should be the first line of defense. This, if it's approved, molnupiravir should be considered a second line agent for acute infection.
Thank you, Brother Hall. Brother Dawson, do you think that these treatments could serve as turning points for other COVID-19 treatments?
Well, hopefully, theoretically, yes. However, as Brother Hall mentioned, the key to preventing the spread of COVID vaccine, COVID-19 are the vaccines. But far and above, those are the recommended treatments and the way to get out of this pandemic. Now, both the monoclonal antibodies and the COVID-19 pill are medications that you take to ameliorate the symptoms of COVID-19 after you have received it and after you are actually diagnosed with the condition. So if we can prevent transmission and else make sure that symptoms are mild. Now, keep in mind that people who need monoclonal antibodies, and for example, these are typically people who have much more significant disease and are more ill, or they have pre-existing conditions that put them at risk for having more significant disease. So again, taking the vaccine is going to be the first line of defense. We're hoping that these treatments will open the way to other doors to actually attack the virus, again, preventing it from replicating and preventing it from attaching to the cell and entering the cell to actually produce more disease. But again, the vaccine is the number one way to fight this infection.
Thank you, Brother Dawson. And the takeaway points from this segment are to make sure that you get your vaccine so that you won't have to end up with, hopefully, that you would not have to end up having to make a choice about one of the treatment options. So it's important to get the vaccine. Let's see. The next segment is going to cover moral and ethical implications for COVID-19. In an article written by Elizabeth Chuck for NBC News on October 27, 2021, she stated that stress from the pandemic has made even basic decision-making difficult. According to the CDC, 181 million people are fully vaccinated. 14 million have received the booster shot. In the article, findings from the American Psychological Association Stress in America survey conducted by the Harris poll found that 32% of adults are so stressed by the pandemic that they sometimes wrestle with the daily tasks such as choosing what to eat or what to wear. Hispanic and Black adults were more likely than white adults to say they are sometimes so stressed about the pandemic that they struggle to make even basic decisions. This is important to note, often because people are generally trying to juggle day-to-day decision-making and responsibilities, in many instances struggle with ethical and moral responsibilities and decisions related to safety practices and concerns for themselves and how these everyday decisions affect others. Brother Hall, I know that we could probably have a session on this topic alone, but we're going to try to tackle some of them a little bit today in this discussion. So what are some general health tips and behaviors that you can provide for folks that may be stress related to the pandemic that are protective of health and has moral and ethical consideration at the individual level?
Yeah, it's a great question, and there are a lot of different answers. But I think in general, it's important to recognize that the anxiety, the uncertainty, the frustration that people feel is absolutely appropriate in this situation. The messaging about the pandemic, the risk that it posed from the very beginning was distorted and inaccurate. Influenced by the political environment, people were taking in information about the pandemic without nuance, without understanding that this, like every other issue in adult life, has gray areas. So one area that I've heard come up multiple times and I've had to try and contextualize for people is the initial guidance regarding masks, and how Dr. Fauci, who is one of the leading experts in virology and infectious disease, said in the beginning that we didn't need to be wearing masks in the general public, but then later altered that guidance. And what's missing in considering how that messaging rolled out is the timing and what was actually happened that made him change his decisions. Mask wearing at the time we first discovered the emerging threat of the SARS-CoV-2 pandemic, we did not have large supplies of PPE to go around. His initial guidance was intended to keep people from hoarding PPE that would have been more useful to people in hospital settings as first responders to deal with critically ill patients. Once some of that supply chain issue abated, and the needs of the needs of the general population for safety became to wear masks as part of our first line defense, he changed that. So it wasn't that he was unclear; it was that the scale and the amplification of the situation in that short period of time accelerated to a point where the messaging had to be changed. Other examples like that have happened and have created just an air of confusion. The point is that we are dealing with something that affects every one of us. So from North Carolina, where I live, all the way to Sudan and Africa, up to Germany, everybody who has this is a potential risk to everyone who doesn't. This virus does not care who it affects, and populations that choose to follow the guidance and make responsible decisions do well, but they are still under threat by those populations who choose not to do it. The virus will continue, and as I mentioned, it does have the capacity to present itself in new and different ways. The longer it's allowed to live among us unsuppressed, the more potential there is for us to see it reemerge in a more threatening form. So in terms of the moral imperative, getting vaccinated, doing that for yourself, but also for people who live among us that are vulnerable and don't have the benefit of well-functioning immune systems to protect them, even when they've been vaccinated, can't be overstated. You have to think about the common good in this set of decisions. It's not just about what you can manage and what can happen to you. It's much more about who gets it that can't handle it. We are up to 750,000 deaths, as I mentioned earlier, and that type of scale of death has not been seen before in the modern era. The reason why is because of public health and the information that we gain from that field of study. What public health in general as a discipline has informed us is that the more of the population that's vaccinated, the quicker we can achieve this state of herd immunity, the better we are able to protect members among us that are continually under threat because of other medical conditions that challenge their immune systems. So it is a difficult thing to deal with, particularly since it doesn't seem to be going away. But the point is, the hesitancy, the reluctance to get the vaccine is what's making this stick around. And it will not stick around and stay the same. When the Wuhan variant first hit the coast of the United States, the infectivity was about, for every one person that had it, maybe 2 people could get infected. Now with Delta variant, for every one person that has it, about 8 people or so can get it. So what you're seeing is a situation where this thing is learning and changing, and it's because it's been allowed to exist among us for so long. So the best way to manage the anxiety is to get rid of the problem. Best way to get rid of the problem is to get vaccinated. We're still under 60% fully vaccinated among the adult population. We need to hit that magic number of about 70, but for my taste, for us to be up at 80% in the population, I think that could shut the door on this and give us a return to normal life.
Thank you, Brother Hall. Brother Dawson, I'll allow you an opportunity to provide commentary on that as well, the moral and ethical implications, maybe from the communal aspect.
Well, Brother Brown, I think the moral and ethical implications have pretty much slapped us in the face throughout this coronavirus pandemic. It's not only about caring about yourself, but it's caring about your fellow man and protecting not only yourself, but protecting your family, your loved ones, and also the people that you don't know. What we do know is that the people who, the main methods of protecting ourselves, besides the vaccine, and as we discussed, that's imperative. That's the imperative way to prevent this infection. That's the first line of defense. But other one, common sense issues, social distancing, keeping people 6 feet apart or 2 arm lengths, washing hands very frequently, and wearing a face mask. That includes a mask that covers both your mouth and your nose. And the pushback from Americans is a bit mind-boggling, because this is a simple enough preventive measure, and the resistance and the politicization of this, of wearing masks is put us in a circumstance and situation where if you look at the CDC map, the United States is red hot. So we still have the highest incidence of COVID in the world. I repeat, the highest incidence of COVID in the world. We're still red with all of the technology and all the resources at our command. And the primary reason for that is because American citizens, by and large, not enough Americans have decided to protect themselves and their fellow Americans by getting vaccinated and by wearing masks. And so it's important that we continue to do this, and we continue to impress upon our friends, our coworkers, our neighbors who have chosen not to get vaccinated, those who refuse to wear masks in public, even inside stores and supermarkets and movie theaters, even though they know they have not been vaccinated. We need to continue to impress upon them the importance of doing these simple tasks to prevent and protect all of us. Because as Brother Hall mentioned, we're trying to reach herd immunity, and that will go a long way toward stopping the spread of this virus and ending this pandemic once and for all. The fact that children are now able to get vaccinated is certainly a step in the right direction, because that's 22% of the population that was not able to get vaccinated prior to this week. So certainly we are moving in the right direction. But the number of adults that have still not chosen to get vaccinated is problematic. So that is something we still have to work on very seriously.
Thank you, Brother Dawson. Thank you, Brother Dawson. Thank you, Brother Hall. I'll summarize key takeaway points again for this segment and actually for the entire discussion. And the CDC recommends everyone 12 years and older should get a COVID-19 vaccine. The CDC also recommends children 5 to 11 can get the Pfizer vaccine. And according to the CDC, boosters are helpful to improve protections that may reduce over time, especially among certain populations against mild and moderate disease. Avoid crowds in poorly ventilated spaces. Social distance, at least 6 feet away from others. Hand hygiene is the most important measure to prevent the spread of infections. Wear a mask. Personal protective equipment refers to wearable equipment that is designed to protect from exposure to or contact with infectious agents. Exercise respiratory hygiene, cough etiquette. Infection prevention measures are designed to limit the transmission of respiratory pathogens spread by droplets or airborne routes. Clean and disinfect. Routine cleaning and disinfection of environmental surfaces should be included as part of an infection and prevention plan. We want to thank you for your participation in tonight's discussion. Brother Hall, Brother Dawson, this concludes our moderated session of this discussion. We want to open it up to Brother Sterling to sort of see if he had concluding thoughts about our discussion this evening.
Thank you. It's a fantastic show. I do have a question for each of you. Part of what's been going on nationally has been a sense that COVID is now being put in perspective. One of the conversations that I have relatively often is now that the death rate, still at 1,000 to 1,600 per day, is now settling down into the realms of the other leading causes of disease, cancer and hypertension, for example. What that means to a lot of individuals is that now COVID is becoming just another disease. And in as much as that appears to be true, it's not at all true, because we still are subject to waves. What advice would you give to either refute that statement or to get people to say that now is the time that you really should start thinking about how you're going to live your life, how you're going to incorporate the threat of COVID into your life, and whether or not boosters are going to be a thing that we have to deal with moving into the future? There's a lot to unpack there, but I think a lot of people who watch this will be looking not necessarily just for the guidance, but for what the next steps forward are. So please address that.
Well, Brother Sterling, that is, as you mentioned, that's a lot to unpack there, and there are a lot of considerations. First of all, I think I want to revert back to a comment I made about doing everything that we can possibly do to prevent the spread of this vaccine and prevent transmission to others. Social distancing, washing your hands, wearing a mask, and taking either one of the recommended COVID vaccines. As Brother Hall mentioned, these viruses are learning, they mutate. And as they replicate and are transmitted, they change. And we'll be foolish and it would be unwise to assume that we're going to continue, that these vaccines that we currently are using are going to continue to be effective to the same degree if we don't do what we can to stop the transmission and spread of the vaccine as they are. If we are able to reach herd immunity, then we can get to a point where we may have turned the tide, so to speak. But what I'm concerned about is that COVID may not become a permanent part of our landscape because we're not taking the steps to eradicate it. and that a year from now or 2 years from now, we will still have to wear masks. We'll have to get boosters, and we'll have to be concerned about transmitting a potential life-threatening infection to our loved ones, especially those who are elderly and have pre-existing conditions. So I'm concerned and a bit troubled about the unwillingness of parts of our population to really take this seriously and look at it head on, and tackle it head on.
I agree with Brother Dawson. It's actually a good point to remind those listening of a point that he made earlier, which was that essentially the virus has the capacity to change. We change and adapt. It won't change and adapt to get weaker. It'll change and adapt to get stronger. The reason why booster dosing is necessary is because of the increased transmissibility of Delta variant, but also because there's so much circulating virus in Texas, Louisiana, Mississippi, Alabama, Florida, are all hotbeds for COVID-19 disease, SARS-CoV-2 infection. The longer those territories continue in resistance to getting vaccinated, the virus is circulating in those communities. It is learning ways or experimenting with ways, so to speak, to get around the defenses of the human immune system, and it is adapting. So it's changing to be better at what it does. When that type of threat exists in the community, unless the community comes together, makes a concerted effort to in a unified way, employ mechanisms that will stamp that virus out, reduce the number of places where it could go to spread, the longer it will stay. We're not at the point yet where people are widely recommending or sort of setting the expectation that there will be a need for like an annual vaccination. But I anticipate, particularly as we head into the winter months, solidly into the winter months, that we'll see cases run up again, and that booster dosing may be a discussion that we have to have again in the future. So it's when you talk about, well, when is it over? There are objective ways to tell. Go to the CDC COVID data tracker. Look at the percentage of the population that is fully vaccinated. That gives you an indication of how close we are to herd immunity. As of today, we are just under 57%. If the goal is 70%, that we are shy of that going into one of the major hot periods in the year for respiratory virus infection. So, you got to be thoughtful about this. Think about people, again, who are vulnerable, whose immune systems can't respond even to the vaccine to protect them, and get protected yourself, get vaccinated yourself, so that you are just one less place for the virus to go.
I think I would also mention that at least at this point, we are hopeful, and all the research indicates that 70% will probably be enough to where we reach herd immunity and limit the transmission of this of COVID-19. However, each viral infection has a different percentage of the population that's required with vaccination or either natural immunity from having been infected with the infection to reach herd immunity. So we aren't absolutely certain that 70% will be enough, but we are still quite a ways from that. And we won't be absolutely sure that we've stamped it out until we reach that 70% of the population that's either vaccinated or has been exposed to the native infection. And so we're hopeful that that will do it, but we have to strive to get there first, and that is the goal for all. Should be the goal for all of us.
Well, we have reached the top of the hour, and I want to thank each of you for a fantastic presentation. Certainly thanks to Brother Deputy Surgeon General Brown for leading the discussion. I just want to end with comments that put into context with Doctors Dawson and Hall have just said. I am actually not at all optimistic about the prospects of reaching herd immunity. The concept of herd immunity actually presumes a relatively even spread of that 70 to 75% across the landscape. What we have here is a situation in which it is quite uneven. This is a disease of the unimmunized, and you have large swaths of the country that in block have dramatically lower than 40% immunization rates. And those areas, as I believe it was Dr. Hall that mentioned, serve as incubators for the rest of the country. And in as much as that incubator status exists, then the risk for additional variants that can evade and then maneuver around the rest of the country continues to exist. So until and unless proven otherwise, I think that the threat of another wave this respiratory season, this winter, is a real thing to be considered. The lesson that we have learned here is that, influenza has been around for 100 years, from back when it was first the Spanish flu to herd immunity not being able to be reached, and the strains continue to change even now. I think the chances of seeing something like that are at least as real as us reaching that 70%. On the other hand, the one thing that we do have upon us that could bode well for the prospects of getting well above that 70% number is the prospect of getting children immunized, because they do represent another 20 to 25% of the population that's eligible for these vaccines. Reducing the viral load in the communities by attacking children, or addressing children, I should say, in that way could really get that number up, even in communities where the immunization rates currently are quite low. What all of this means to the viewer is that you have to accept responsibility for you and yours. This is a disease that, as was mentioned, doesn't care who it kills. And over time, you're going to continue to see it kill the vulnerable, the most at risk amongst us. And we just don't need to be a society in which we allow our elderly and those who, through no fault of their own, have diseases that lower their immune systems, continue to be picked off year after year, decade after decade. So take care of yourself, and perhaps this will be like the invisible hand, the economic theory, saying that each of us taking care of our own selfish interests may actually elevate and lift the entire society. Let's hope that that's the case. Let's hope that you've gotten what you needed out of this session. We'll be looking for you again this same time next week, where we'll be talking about managing diabetes in your families. Thank you for participating, and on behalf of our General President, Brother Dr. Willis Lonson III, have a great evening, and thanks for being with us. Good night.